Fine, how are you?
Very well. I remember last time we talked a lot about the introductory parts of arthritis.
Yeah, of rheumatology, rheumatic diseases.
Yes, rheumatic diseases, and
Yeah.
just talking about why you began the clinic, the effects of rheumatic diseases in Kenya, what the government is doing. We really covered a lot.
Mm-hmm.
But today I wanted us to focus more on arthritis in children. Maybe you can define that, and is it something that is present in children? Because a lot of times we hear about arthritis and we think about old age. So maybe you can introduce us to arthritis in children.
Yeah, a number of rheumatic diseases affect children. And this can be from age 0, day 1.
Wow.
Let me say 0 onwards, from day 1. From the day a child is born, there are a number of rheumatic diseases which affect children. Arthritis is one of them. And if you recall, we said arthritis is the presence of swollen,
Painful joints.
which may also be painful,
Yeah.
joint, or a joint which is just painful with movement, but is not
Yes.
swollen. But the most important thing there is joint swelling. I'm talking about this because when you come to children, the swelling is very important. Yeah, because you will find when a child has maybe a joint which has arthritis, is swollen but is not painful, this child will continue to play and nobody will know that there's something going on abnormal. Actually, sometimes it goes to the extent that the joint is swollen, the child is playing until you get that limb has grown longer than the other one, so that when the child stands, that limb which is affected is folded. The other one is straight, this one is folded. Like say if it is the knee, the right knee, you will find that limb, the right knee is folded, we say flexed. And the child is comfortable. The other one is standing straight, the left one, the right one is folded at the knee. And the child is comfortable. The knee is slightly swollen because the joint is not painful. But at that time now, the joint is deforming.
Interesting, but you're talking about a 0-year-old.
No, this one, I'm saying arthritis can start from the day, we say from the day 0
You're saying from the 0
onwards.
So at birth.
It can start from day 0 onwards. This type is those ages of maybe 5 years.
Oh, yes.
And that, the ones who are now playing around. The different arthritis in children are 7 types.
Yeah.
Yeah, and these 7 types, they have different characteristics, kind of. And even the age groups which are affected are a bit different from one type to another.
Yeah.
So the one I'm describing is one type.
Okay.
And this one now, why I'm still talking about this, starting with it, because this is a silent killer, a silent problem. But once that limb is lengthened, it is lengthened, it's already done. So maybe by the time you are seeking help, the limb is already longer than the other one if you are not very observant. Yeah, I'm trying to say things which are kind of like which come as complications without notice.
Without notice.
Because the other thing which can come as a complication without notice is arthritis in children commonly affects the eye, and it can lead to loss of sight. So sometimes you find a child presents to the ophthalmologist, the eye doctor, because the child is losing sight. Okay. Now when the ophthalmologist looks at that eye, then he'll see something we call uveitis. That is inflammation inside the eye. And the type of inflammation inside the eye will tell him that this one is arthritis. Then he'll refer the child back to the rheumatologist to treat that eye. Because it can start with the eye, then now the joints are affected later. Yeah. So these are things which one needs to know from the outset, because they are out of the way, kind of.
Yeah, maybe you can perhaps even just taking you back to define the initials JIA.
Juvenile idiopathic arthritis is arthritis in a person from age 0 to 16. Age between 0 and 16. Yeah. A child in that arthritis in that age group, which has been there for at least 6 weeks, and whose cause is not known.
That's interesting.
So this arthritis has to be in somebody of age 0 to 16. It has been there for at least 6 weeks, and the cause is not known. That's why the word idiopathic is there. Normally when something is idiopathic, it means the cause is not known. So we call it juvenile idiopathic arthritis.
It's interesting.
Yeah.
So how would you know, how would you diagnose the juvenile idiopathic arthritis, yet the cause is not known? It looks like it's a difficult disease to even know.
Yeah, so you have to exclude other causes. If somebody comes with painful or swollen joints, you have to exclude other causes of a painful swollen joint. The most common things there now we deal with are things like connective tissue disorders, things like lupus. So because if you get one of those things, then now it is not JIA. If now you name it, if it is lupus causing a swollen painful joint in a child or in somebody age 0 to 16, then that one is now lupus. It is not juvenile idiopathic arthritis because the cause is known. Yes.
So it's like you diagnose it by elimination
Exclusion.
or something.
We call them diagnosis of exclusion. Yeah, you exclude every other possible cause. Like even some of the malignancies, cancers, even of the blood, can also present as joint pains.
Yes.
Infections can present as joint pain. Yeah, so you have to exclude those things. So you will do tests of things you want to exclude. Once you have excluded them, then now you can say this person has juvenile idiopathic arthritis.
So how long does that take? Because, for example, my child is maybe 5 years old. He comes to you and we notice these symptoms. How long will it take for us to actually come to a conclusion that this is juvenile idiopathic arthritis?
It doesn't take a very long time. Yeah, most of the things we exclude because the child, when they come, they may not come with obvious features of other diseases. Yeah. So commonly the things to exclude are connective tissue disorders commonly. But when we go to the type we call systemic type, which we will talk about, where a fever is present, then of course we have to exclude infections and malignancies and all those kind of things. But if there are no fevers, then most of the times we exclude the connective tissue disorders. And it doesn't take a long time. It takes something like within a week, the results should be out.
Oh, so it's not something that takes a bit of time.
No.
Months to actually be.
No, within a week, the results should be out.
Oh, that's
the only thing to say here again is the autoimmune tests which are done. Mostly our public hospitals don't do them. You remember when we were talking about the challenges which we are facing in rheumatology.
Yes.
So again, you will find most of the autoimmune tests, the public hospitals are not doing them. So the patient has to bear the cost of doing them in private hospitals, and they're not cheap. Like if you remember last time I was talking about the common autoimmune tests we do will cost upwards of around 30,000 shillings.
Wow.
Yeah.
So the length of time is more about finding the place to do the tests. What I'm saying is that the test itself can take 1 week.
Yeah.
But by the time one actually figures out where they can actually do this test.
No, they are there outside of public hospitals.
Okay.
The tests are available.
So for example, if I were to go to a public hospital, I'm not sure what my son or daughter is suffering from.
Mm-hmm.
And so the physician there should actually be able to send me for this test.
Yes.
Okay. And we said last time actually that a general physician can be able to diagnose rheumatic diseases.
Yeah, should be able to send you for the test.
Okay.
Now in children,
in
children it becomes more tricky. In children, it's difficult to say that a general physician will be able to. They should be able to refer.
What about a pediatric?
A pediatric also should be able to refer, not
so it's
manage.
Still not easy for them to actually figure out.
They not manage them.
Wow.
They refer them to the rheumatologist.
So we are starting to see the disconnect. We can see the test can take 1 week.
Yes.
But it depends on whose hands you
So
fall.
these are not. You see now, like we have in the counties, I'm sure I think most of the counties have pediatricians. But pediatricians will not be able to manage pediatric rheumatology conditions.
Wow.
Yeah.
Okay.
And the
But at least they should be able to
they should recognize. They should be able to recognize.
And refer.
Yes, and refer.
Yeah, because that's what would want them to be able to do at that level. Yeah. Otherwise, you don't want a child being taken through many tests.
Yes.
Like they say, a wild goose chase looking for.
Yeah, the pediatricians know what can cause particular problems in a child. So they'll dig for those causes. And at the back of their minds, they also know rheumatology conditions can do this. So as they dig for those causes, when they find things are getting difficult, because I'm telling you it's a diagnosis of exclusion. So they have done what they think can cause these symptoms, and they are not finding anything. Then they call in the rheumatologist. Like around here, if they are here, they call us in.
Wonderful. So that means also that, just back to my question, as much as we say the test can take 1 week, but by the time maybe the pediatrician or the general physician decides that this is the test to do, it may take a while.
That may take a while.
Yeah.
Because again, pediatrics are not every child is able to see a pediatrician. Because even when you talk about the county, you may find a private practitioner who is a pediatrician, or you may find the pediatrician is in the county hospital, but not every patient, not every child in the county goes to the county hospital. So they may still not be able to reach the correct diagnosis and treatment. And that's why I was telling you that we would see children coming when they are already deformed.
Yes.
Yeah. I think I've mentioned that when we are doing general, when we are talking generally. Many times we find children coming from far locations, the counties which are far from Nairobi, coming with the joints which are already fixed, deformed and fixed. The child is carried, and depending on how far it has gone, the child may not be able to walk again. Some of them are just crawling. Yeah.